I'm going to make this as formal and as informal as you all want to. I know that everybody kind of has different professional development tracks in terms of kind of what that looks like. Everybody has different goals in terms of their short-term career, long-term career. I think at the end of the day, it benefits the individuals to continually reflect, to be asking yourself, are you okay with where you're at? Are you okay with the trajectory you've had recently? And what can you do to become a more valuable member of your team? And, for a lot of people, maybe or maybe not hearing the word intrapreneur, but I think the individuals that largely kind of empower themselves with information, kind of understand how business works, kind of understand how they can be a more valuable member of a team, and put themselves in a situation where they are carving out a niche for themselves under an umbrella. You're going to make yourself more valuable. You're also going to make conversations surrounding benefits, time off, compensation easier, because you become harder and harder to quote unquote replace. So this can kind of be like a professional leadership development block. I can get a little bit into like the 3 C's that I think are just important for just about anybody. That's financial capital, social capital, intellectual capital. That goes on a personal front and a business front as well. But before we jump in, why doesn't everybody, again, just brief name, background, and kind of how you feel overall about kind of where you've been at with regards to your professional development and maybe what you foresee yourself working into. And I know, it's kind of putting you on the spot, making you think big picture a little bit, but again, I think it's an opportunity to kind of reflect about where you're at, where you want your career to go. Do you want to create leverage for yourself in one aspect of your life or another? I can speak for our organization where we have people who have created value and their schedule gets more flexible and their hours get more flexible. And obviously it becomes easier and easier to warrant pay increases because the individual knows that they've created value for themselves. I do hear a lot of negative things about healthcare, but I do think there's a lot of organizations out there that do generally want to do right by their people, and it becomes harder and harder not to. When you're putting yourself in a situation where you're thinking about how you operate, how you deliver value differently. So I know I asked you a question and then talked a little bit more, but name, kind of reflect a little bit about kind of your journey to this point, and where you might see yourself from a role standpoint in the months or years ahead. Oh, man. If I have to jump in here and do it, I'll just go ahead and,
I can go first.
All right, go ahead, Andrew.
So I'm Andrew. I'm a 3rd-year physical therapy student at Marymount in Arlington. So currently I'm in my first full-time clinical experience. It's been an interesting transition. So before school, I was a PTA for about 5 years. So in the short term, my big thing is for development is just becoming a more well-rounded clinician, especially like within like the evaluation, like plan of care, like discharge kind of thing, like just the basic skills. Because on the treatment half, I feel pretty confident. And then moving forward, I honestly haven't thought that far ahead, and I feel like that's bad, but like I'm still trying to figure out my niche and like where I can find leverage in the future. And that's just something like, again, like I just have to kind of think and kind of work on at this point, thinking long term.
Yes, and not to say that you are in a rush or you have to be in a rush by any means, but in a situation, and this is kind of very blanket advice for just about anybody at any point in their life, but if you feel like you don't know, then you need to expose yourselves to more. You just have not tried enough things, because there should be kind of this self, kind of selection with regards to things that you don't like, things that you like, and you should, with more information, only get closer and closer to that end range target. So my question for you would largely potentially be, are you also doing enough experiences outside of former schooling to put yourself in a situation where you can learn more? Or are you relying maybe on Marymount solely to kind of help puts you in a position where you're getting information there. It's never to speak negatively about school, but I think that, we always can kind of expose ourselves to more than just school. As we go through grad school, are you able to reach out and potentially spend time at places that might add value to you in terms of what you're good at, what you like. And then some things too that, that I always think about is, are we naturally doing things outside of school? I only say that just remembering certain people going through the school process and it was like 100% school and there was not much else. I think it's really, really healthy just as an individual to just kind of be well-rounded and, whether or not it's volunteer or work or doing certain things to kind of enrich your life, some of that personal stuff will carry over. So any thoughts on that?
I do feel like the last semester it became, because like I am not a fan of acute care, and acute care was like the bane of my existence.
Yep.
So this past semester was definitely more school focused, but yeah, like other semesters, and I try to be exposed to other experiences. Like this is actually the second mentorship I've done this year. So I've done a different one earlier, and it's more like fitness, strength and conditioning related. There's a lot of like clinicians outside of school that I hang out with and work with, like for guidance, and that's just in terms of just like education. Volunteering is something I've been trying to get into, but like the last like again semester has been kind of like wonky because the school does have a lot of opportunities to work with like grant projects, and they have outreach programs. But like the last semester and then just being full-time clinic, I'm just trying to get like my bearings there. I feel like that aspect of personal development has been kind of stunned like the last like 5, 6, 7 months. But it is an area like I have been thinking about trying to get more exposure to.
Yeah, no, it's good. And like for you, like if you're in this and then you did something that's more strength and conditioning, like there's a lot of good gyms in that area. So, can you go spend time in some of the different fitness entities? Even sometimes, I mean, it's valuable to spend $20 to drop into an environment sometimes, just be a part of it, just work out, get to know people, understand what some of your patients might go through. You might have a better idea of what CrossFit's like. You might have a better idea of what F45 or Orange Theory is like. You might pop into a yoga class and get some meaningful things out of that. So sometimes, investing in yourself on a personal level also looks different because you're actually taking care of your physical self and you're learning at the same time. I think it's something that's worked really, really well for me over time, and also goes hand in hand with like a social capital piece where, you have a certain amount of social capital because you're expanding your relationships while also putting yourself in a position where there is some immediate benefit on a fitness level. So we'll dive into 3Cs a little bit more as we go, but anybody want to go next?
I can go next just because I kind of relate to that piece that you kind of mentioned at the end about like CrossFit and like other fitness entities. So I'm Jacob. I work in Fort Worth, Texas. I've been out for like a year, a little bit over a year now. So I'm kind of coming up on that year turn, trying to figure things out. But I actually recently started going to a CrossFit gym out here like less than a month ago. And it is really interesting. Like part of why I wanted to do it is because I don't feel like I train like an athlete on my own. I feel very unathletic right now. So I kind of joined, but it's also been nice to like be on the other side of like everything. Cause we spend so much time in the clinic, like writing programs, coaching patients and working with individuals on that front. And then being able to flip the script and be like, okay, I'm just going to show up and I'm going to be coached. I'm going to be like critiqued on technique. I'm going to like have someone tell me what to do. It's been really nice, honestly. Like it takes a lot of like burden off of me mentally to not have to worry about thinking about my workouts and that type of stuff. But I've also like pulled pieces from some of the things I'm doing there and kind of utilizing them in the clinic. And then I have a handful of CrossFitters on my schedule right now. And it's like, you kind of understand like what the dynamic is. And it's also been nice because I've always been one that's like a anti-CrossFit guy. Like I'm kind of like very skeptical.
Yeah.
And
I was there at one point. I can relate.
Yeah. And it's nice to see that like not every place out there is like the shitty ones you hear about. Like there's actually good places out there and there's a good community and all of that. So I relate to that. And I think that it really has been nice for like me professionally too, not only just like health and fitness wise. So I really resonated with that piece just now. But
Yeah, and there's nothing better than going into an environment, authentically interacting with people, actually becoming a part of the community. And then, you know, you could go in there and you could start being a workshop guy. You could be doing workshops like once a month, once a quarter, like, and then your caseload starts to look different. And then it goes into the entrepreneurial piece. Now you're saying, hey, I'm bringing patients to the office. I'm driving business for you. I'm doing this on my own time. And then somebody should, if they're an intelligent business owner, and kind of go, all right, well, look, this is directly benefiting the company. How do we pour into this niche? How do we pour into this individual more so that potentially you're happier because you feel supported, your caseload is enjoyable to work with because it suits one of your, you know, interests and passions. And even when you're doing extra, quote unquote, on the weekends, it doesn't feel like work, because you're engaging with people you do on a regular basis, and you're putting yourself in a situation where the material probably wasn't something that you had to really dive deep into the bag with regards to creating stuff for this population group. You're familiar with it already. You're interacting with it on a regular basis. You probably during workouts have already been thinking of ways that you could probably do stuff to add value depending on the lift or the programming or whatever. And again, it's that you're creating leverage for yourself by doing something you like doing, spending more time of it, and then kind of working with whoever is a leader at your company to put yourself in a position where that time value conversation comes in. And again, things look different where, I mean, we have something called R2P masters. You know, you can get to a certain point and you're in a community and you pull hours off your schedule. Like, all right, well, you don't have to work 40 hours. Like you can work 39 or work 38 and you can just plug out and do an hour workshop and kind of get paid to do that, and put yourself in a situation again where you are starting to build out your own caseload, and it's that entrepreneur thing again. So I love it. Ariel, Kayla.
So my name's Ariel. That's okay. It's okay. I consider myself a baby professionally. I'm only like 5 months into my first big girl job, working mostly outpatient. So talking about creating leverage, I had a cool opportunity to negotiate because I had been offered a job at 2 different positions. So I was able to use my background with dance to talk about, bringing in like the dance community and looking to hopefully maybe be able to do workshops and stuff in the future. But I know right now, my manager has been like marketing the local dance studios and stuff like, hey, we have a dance specialist kind of. So that's kind of one niche that I'm going into, and I'm actually going to get my level 1 pelvic health certificate course in like 2 months, I think. So I'm really excited about that and kind of bridging like dance and female athletes with the whole, I think the underserved population that is people that have pelvic health dysfunction. And I want to work with women postpartum as well. So I follow Kelly and I look at all her stuff all the time, and she's a great resource for me. So right now, just kind of bouncing back off of what am I doing outside of work. I just started back at a local gym. I actually switched from like a big like Crunch, which is like a chain gym, to like mom and pop little gym. And I have the opportunity to work with some of the people there and start like marketing myself as someone who's a physical therapist. Like, oh, I see that you're having these kind of difficulties, or like, people ask, they need help with spots and stuff. And I'm like, okay, great. To be able to kind of market myself as an individual and also plug my company that I work for as well. So there's a little bit of both happening there. So I get really excited about working with people who I know want to get better also. Especially I find that more in that like athletic population. But so that's kind of where I see myself developing professionally. I think we are in a service industry, and I love that we get to serve people. It's really rewarding. So